Good evening, everybody. Tonight's presentation will be one of the collaborating centers work with Wipro Manila on digital health profiling and maturity assessment. I titled this talk because I wanted to emphasize that it was a co-creation process in the Pacific Islands. I'd acknowledge my team, the team who central to this work, Rui and Jun Gao from the Health Information and Intelligence Unit Data Strategy and Innovation Group in the WHO Regional Office in Manila, and my colleague Sameera. It's a custom in Australia to acknowledge countries when we start a meeting. I therefore acknowledge the people of the Eora Nation as the first custodians of the land on which I work, and I pay my respect to elders past, present, and emerging, and any who might be here today. Further on, acknowledgements, contributions from the WHO Division of Pacific Technical Support, particularly Katri Kontio, and the WHO country officers for their help throughout the development of the Digital Health Profile Maturity Assessment Toolkit. We also thank the representatives of the participating Pacific Island countries who tested and provided feedback on the toolkit at the 2019 Pacific Health Information Network meeting in Noumea, New Caledonia. What we'd like to do today is to present you with a brief description of the project and a brief description of the outputs and the testing. And then we'll take a closer look at the Digital Health Profile and Maturity Assessment Toolkit, give you an example, and then we'll open up the discussion. And we're really looking forward to your thoughts and how we can actually improve this tool and toolkit as we take it along into the future. I'll call upon Sameera to take us through the description of the project.
Thank you, Teng, and thank you, Siaw, for organizing. And good evening, everybody who's joined in. I appreciate you taking your time to listen in today. And I'd also like to acknowledge the traditional custodians of the land in Sydney that I'm dialing in from, and pay my respects to any elders past, present, and emerging. And so just to give all of you a background, a very quick summary of what our project was about. So the rationale was the fact that we aimed, what we wanted to do was that we needed to create some sort of unifying or an attempt to start unifying a method of how we assess the digital health capability maturity of a country, and so that the knowledge, skills, and resources of the country are utilized so that the digital health and overall health actually can systematically develop and can be implemented and can be scaled up and can be evaluated in an ongoing and streamlined manner, and therefore support the country's health priorities and add to the sustainable development goals in turn. So the objective of our project, the Digital Health Profiling and Maturity Assessment Toolkit that we created, as Teng said, in collaboration with the WHO. So we call it DHPMAT because, as you can see, it's quite a big name. So it was done, the aim of this work was to facilitate informed discussion within a country among the key stakeholders, so that they can come to some sort of consensus on the maturity of the essential digital health foundations. I will be taking you through what the essential digital health foundations are and the quality improvement programs, so that because monitoring and evaluation, as you know, is a really important part of any implementation, and so that all countries can harness their digital health tools, and then they can strengthen each country can strengthen their health system in order to address their health priorities, keeping in mind the country's individual context. Next slide, please. Teng?
Yes, it's on.
No, I still see. I just need to move to the next slide, please. Thank you. So the methods that we adopted, essentially, this is a very brief overview of how we conducted this project till date. So all of us, we did a desktop review of literature. So literature that was published in scientific journals, as well as all Grail literature, as well as official documents that were collated by the WHO Western Pacific Regional Office, and some of which were fed into the work through the Division of Technical Support, headed by Ms. Katri Concio, who's located in Fiji. And then some of the key country stakeholders, they did contribute to collating the key digital health features of their individual countries, so that we had an idea of how to actually go about assessing the digital health maturity, because information, as you know, or data, is the key to having any sort of work to be assessed. So it was really important to make sure we had some tangible data in hand, and that was really helpful, all the contribution that we got, and because there had to be some sort of deadline and some sort of face-to-face or interaction with the country stakeholders. So the Western Pacific Regional Office, Mr. Jingao and Dr. Jingao and Dr. Ruizu, they felt that it would be best to introduce this work, the work that we did so far at last year's Pacific Health Information Network meeting in New Caledonia. And it was a good workshop where this work was officially introduced to the country representatives. And some of them also gave feedback on the DHPMAT, of that version of the DHPMAT at the point. A list of indicators were comprehensively, like we had a list of around 17 indicators to comprehensively describe each country's digital health profile. And we will take you through an example later of what a digital health profile of a country looks like. And then based on the information in the profile, as well as any extra information that was sourced through different kinds of literature, we performed the maturity assessment and put it together as a 2-pager. And we used the 4 essential digital health foundations so that they could be assessed with using those indicators. And then they were all put together, all the documents were put together and packaged, so to speak, along with an evaluation form, as well as a user guide, and of course the description of the background and methods are put together and packaged for each of the individual 13 countries before we introduced it at that meeting in New Caledonia last year. This is a very overarching evaluation of the usability testing, the feedback that we received from country delegates. So 11 country delegates gave feedback, which is pretty good. And as you can see, for the rationale and methods, and for the user guide, as well as each country's digital health profile, and the digital health maturity assessment tool, and the general perception was average, and in terms of the user guide, a little above average, as you can tell. So overall, it was overall for a piece of work that they had actually seen and looked at for the first time and tried to use it. It was overall positive feedback. And there was a bit of qualitative feedback too that we managed to obtain at the meeting. So as you can see, these are a few quotes from the qualitative usability testing. A couple of country respondents who wrote a bit of kindly took the time at that very busy meeting to give us some feedback, said that they found that this DHPMAT was a good source of baseline information so that they can compare it with the reality on the ground in their country. And another stakeholder, they did say that because there are a few different toolkits used in the same space, so they will consider it later in when the time is right and when there is a more refined version, essentially. So, and one of the workshop's facilitators, I think this was a very valuable piece of advice, which we know is the whole process of co-creation, essentially, because the ball has to start rolling from one point. And what they essentially said is, now how do we just bring together everybody else and make that bigger we? And now I'll hand it over to Teng so that he can give us a closer look of what the DHPMAT is all about.
Thanks, Ms. Sameera. I just want you to look at the middle quote, considering the number of toolkits used in the country for the same space. That's one of the issues that was raised, that we have what we call a cognitive overload. Too many of the same things floating around. Anyway, let's take a closer look at the DHPMAT. So Sameera has showed you what the process by which we went through. And so what I'd like to do now is to take you through how we developed the assessment tool and how it was applied, and give you an example of it at the end. And then we'll have a discussion on how we can improve it. So essentially, and I'll call it the DHPMAT for to avoid saying too many things, was developed to facilitate informed discussion on the maturity of the essential digital health foundations. And these are defined as the ICT infrastructure, enablers of digital health adoption, essential digital health tools, information sharing, and quality improvement. So these are essential digital health foundations to help a country harness digital tools to strengthen country health systems to address their health priorities. So some basic definitions first, just to kind of make sure that we're roughly on the same page. You've heard of it. I mean, the two main terms are eHealth and digital health. So eHealth was first defined by WHO in 2005 as cost-effective and secure use of ICT to support health and health-related fields, including health services, health surveillance, and health-related literature, education, knowledge, and research. That was in 2005. In 2017, digital health became a favored term. It was a broad umbrella term encompassing eHealth, as well as developing areas of advanced computing in the fields of big data, genomics, and AI, artificial intelligence. The other thing to note about digital health is that it emphasizes the consumers through the promotion of the use of smart devices and equipment such as wearables and desktop and laptops and so on, devices connected through the Internet of Things, as promoted in the WHO classification of digital health interventions. So that's the definition of digital health, because we're talking about digital health maturity assessment. So it is summarized information compiled from national data about the country context, health priorities, digital health developments, and quality improvement programs. Digital health indicators take on different meanings and significance from the perspectives of the patient, community, the health professional, the health organization, the health facility, or the health system. But digital health profiles do not always provide sufficiently granular information for in-depth assessment of digital health maturity at sub-country levels, such as health facilities. And you see why we make that point in a minute. So we talk about digital health and we talk about digital health profiling. All right, so this is what we mean. And what's a maturity model? All right, we talk about maturity assessment. So the maturity model that we adopted for this definition of maturity assessment is essentially a roadmap, and a roadmap for quality improvement. It's a set of structured levels that describe organizational behaviors, practices, and processes that reliably and sustainably produce the required outcomes. In this case, the required outcome might be and would be generally a mature ecosystem with interoperable digital health systems. So that's kind of a QI, a quality improvement process towards an aspired goal. The maturity model also enables the measurement of organizational ability to continuously improve in specific dimensions until it reaches the desired level of maturity. Therefore, you need measurement, evaluation, and quality improvement protocols. And then you need to define the attributes for each maturity level to set SMART goals, right? Specific and achievable and time constraint. So you identify, quantify, and monitor the factors critical to improve and achieve, mature interoperable digital health systems. So essentially, the maturity model can be seen as a roadmap that describes the process components that can lead to better outputs and better outcomes from one level of maturity to the next. So this is the overarching framework as to how we actually look at a maturity assessment tool. So if we look, it is based on functional model of health services. And you can look at health services from 4 perspectives: individuals, families, and communities. And some of the digital health tools at this point, this particular aspect of the framework are electronic health record information, wearables, remote monitoring, mHealth, right? That's used by individuals, families, and people in the community. At the health service provider level, these are people. We talk about EHR, clinical decision support systems, e-pathology, e-prescribing, and so on. And at the organizational level, again, you have the EHR or EMR, telehealth, telemedicine, e-referrals. And at the health system level, that's where you really need the big data stuff, web-based reporting by facilities, real-time reporting, big data analytics, and so on, so that you can start to measure, monitor, and evaluate how good your service is, how accessible your service is, and whether it is cost effective. I guess that's the ultimate aim of digital health, to harness the technologies to support high quality, safe, accessible, equitable, and cost effective care. Now, the essential health foundations to underpin this vision includes, as I mentioned before, essential ICT infrastructure. So I talk about power supply, mobile network, internet bandwidth, and a general kind of look at the infrastructure that's important to maintain essential tools. So we talk about common patient registries, unique ID, electronic health records, and so on. Those are the essential tools. And the other essential health foundation is a readiness to share information. That's where the data architecture, the standards, the security, the privacy to enable trust for people to share information is part of this readiness for information sharing and essential health foundation, digital health foundation. And then finally, the readiness of the health system to promote and to facilitate adoption. So you need policy and legislation in place, you need to have workforce in place, trained workforce, trained in digital health, and use of digital health tools. Financing, money is important, governance, and engagement of various actors, the community, the health professionals, the health managers, and so on and so forth, and the politicians and so on. So this essentially is a framework that was in the Regional Action Agenda on harnessing eHealth for improved health service delivery in the Pacific, Western Pacific, developed and disseminated by WHO WIPRO in 2017. Some of you who are present here might have been part of the workshop that helped to develop this technical document for the regional meeting. Some of the references to help us with this development of the assessment tool includes the Atlas of eHealth Country Profiles, the WHO ITU National eHealth Strategy Toolkit, WHO Guideline on Digital Health Interventions, the WHO Practical Guide and Maps, the mHealth Assessment and Planning for Scale Toolkit. So these are some of the ones that we use to guide us in developing this tool to help facilitate a discussion within the country on how best to assess their maturity, digital health maturity, to systematically choose the right kind of interventions within their capability, within their maturity to implement and to implement successfully. So that's kind of basically the framework. We looked at a number of maturity models. We looked at the focus of the model, all right? We look at the categories they use to assess maturity and how they describe those categories. The two ones we chose to have a range of focus. The Informatics Capability Maturity Model focused on the health organization. The Global Digital Health Index focused on the National Digital Health System at that level. The Health Information Systems Interoperability Maturity Toolkit looked at the health organization from technical and operational perspective with a focus on it. And the Health Information System Stages of Continuous Improvement Toolkit look at a similar area, but look at it from the perspective of continuous quality improvement. So some of the maturity categories used include, they're fairly similar across all the different toolkits. Remember, they think about too many toolkits floating in the same space. But these are selectively selected because they focus on different aspects, different levels, according to the framework that we use that from the Wipro document. So the ICMM looked at managing category of managing information, of using business intelligence, using ICT tools, aligning business and informatics, and managing change. Whereas the Global Digital Health Index looked at leadership and governance, strategy and investment, legislation, policy and compliance, workforce, standards and interoperability, infrastructure, services and applications. Yes, you guys, you see, starting to see a lot of overlap. The Systems Interoperability Maturity Toolkit looked at leadership and governance, human resources, and technology with a number of subcategories. Same thing with the Continuous Improvement Toolkit. You can see it's very similar to the Global Digital Health Index, looking at leadership, governance, management, ICT infrastructure, systems, interoperability, data quality, and data use. The difference lies in how they actually describe and recommend the use of the maturity descriptors. The Informatics Capability Maturity Model looked at general descriptors with practical examples for 5 levels of maturity. And I'll show you an example in a minute. So, but there were 5 levels include basic, control, standardized, optimized, or innovative, right, in an ascending scale. So the respondents reflect on the digital health profile, right, which is what is based on data collected at the national level, and choose a maturity level based on the information. Sorry, sir, on not OI. With the Global Digital Health Index, they got 5 prescriptive descriptors at 5 levels of maturity, with the respondent ticking the descriptor that apply for each category and subcategories. So within these 7 categories, there are subcategories. Now this next one, the Interoperability Maturity Toolkit, actually uses statements with the respondent ticking yes or no to ascertain maturity level. So they're coming closer, that's come between these two at the extremes, all right? And the Interoperability Toolkit and the Continuous Improvement Toolkit start to have similar 5 levels of maturity like the Informatics Capability Maturity Model. The next few slides should make it a little bit clearer. So if you look at the Informatics Capability Maturity Model, it's got very generic levels: basic, control, standardized, optimized, and innovative. At the basic level, right, the main focus of the system is on avoiding downtime. So not many people were at this point in time. Most people are control or above. But it helps to show what it was like about 25, 30, 40 years ago. Unproven, disjointed, uncoordinated processes, unpredictable performance, all right? When you reach the next stage, which is control, the situation is now reactive. There are reactive and is driven by problems. It's a little bit more reliable, but it is driven by problems. the processes become manageable and are getting predictable. So you know if you do something, you're going to get that right, that particular response. But there are a lot of knowledge silos. When they reach the standardized level, things are more reliable and performance is predictable. And they're starting to think about standards. And the system is request driven. So you request things from the system and the systems respond. So that's different from being reactive to a problem in the control situation. And even worse when you're basic, trying to avoid downtime. So predictable performance, knowledge sharing within the organizations, proactive. So some of the criteria that the country can use or the organization can use to decide whether they're controlled or standardized. But essentially the key attribute is request driven at the standardized level and reactive problem driven at the control level. The next stage is optimized. You've gone standardized, you're predictable, you're reliable. And now you're looking at continuous improvement, improving your service. So it's service driven. Efficiency, cross-organization knowledge, sharing, collaboration. So information exchange and so on start to become things you think about. Because you need all those in place and reliable before you can actually do this reliably without taking one step forward and taking 5 steps back. All right, in trying to walk before you can, run before you can walk, proactive and accountable. So these are a lot of starting to have service quality improvement aspects. And innovative is value driven, all right? So the service are working well, you want to add value now, add further value. So it becomes innovative. New dynamic processes, industry level knowledge sharing and collaboration, all right? You drive service innovation, improve models of care, and so on. So this is kind of the 5 levels, which is very similar with the other tools that I mentioned previously, all right? There are 5 levels as well in the couple of toolkits, unlike the Global Digital Health Index. Now, if you look at the Global Digital Health Index maturity descriptors, they've got a lot of statements and you're supposed to tick which ones applies to you. You know, like for instance, taking an example of a national digital health architectural framework and or health information exchange, has it been established in the country? So you have to answer that question and you choose. Level 1 is no, nothing that's happening. Level 2, you're thinking about it, right? You got a architecture and a plan. And number 3, you're actually operating and providing core functions. And then number 4, the government, usually the government, leads and manages and enforces the implementation of the architecture and the information exchange. And then, you know, the next final stage is the architecture and the information exchange provides core data exchange functions, is periodically reviewed and updated to meet the needs of the changing digital health architecture. So there's continuous learning innovation. So it is kind of similar to that 5.5 levels that is in the informatics capability maturity model. Same thing with the Interoperability Maturity Toolkit. But this time they've actually labeled each stage, right? So within the subdomain of human resources capacity development, there's a yes and no answer where it is nascent, equivalent to a basic, no training programs. Emerging, nationally recognized pre-service training curriculum. Established, a plan exists for in-service training and pre-service training. Institutionalization, the country has capacity to train enough staff. All right, so it becomes mainstream and it's doing it very well. And optimize, all right, is sustain. There's sustainable resources for health ministry staff to receive training on information systems and so on. So for the continuous improvement toolkit uses similar categories and similar approach. So this is kind of how we ended up with with the categories in the DHPMAT. So the DHPMAT package contains the digital health profile for the country, and it is the information source on which to base the maturity assessment. And then the maturity assessment toolkit, a tool, all right? is a self-assessment of the strengths and weaknesses of the essential digital foundations. And this, as I mentioned, includes the infrastructure, essential tools, the adoption facilitators, and information sharing, regulation, and environment. And DHPMAT uses the generic descriptors of the maturity levels from basic to control to standardized, optimized to innovative. All right, along the lines of what I described in this slide. And then it also includes a quality improvement scale to monitor, measure, and evaluate the maturity of quality improvement processes for digital health developments. So that's how we got to develop the toolkit, all right? And that's what it contains. This is a visual of a user journey with the DHPMAT. Call it a use case if you like. So the user is, say, in this case, a country X with 100K population. They want to improve the access to health services using digital health solutions and interventions. A working group was formed. Remember, we're talking about this co-creation process in the Pacific. It's been formed to visualize the current state and develop a strategic direction and recommend ways forward to the Ministry of Health. The working group suggests using the DHPMAT as an ongoing assessment and planning tool to facilitate its work. So we kind of broadly divided the use into 3 phases: validation phase, facilitation phase, and the decision-making phase. All right, and these are some of the outputs at the bottom. So in the validation phase, so you review, the DHPMAT asks the questions. What is the current state of digital health in the country? Where are we at compared to ourselves last year, or where went, and compared to our peers in the other Pacific Island countries? So you use the DHPMAT to gain a high-level understanding of the current situation in the country. You also review existing experience, so to look at how we might improve current digital health programs. You look at quality improvement and monitoring of existing projects and programs, and see how it has been evaluated, what the measurements were, what the indicators, and whether it's improving in terms of your country health priorities. So the working group then, with that kind of basic information in the digital health profile, right? These are digital health profile information. Validate the digital health maturity level and documents the rationale. So we got a template. We'll show you in a minute. So then you need to put it into context, all right? In the third phase, in the facilitation phase. What are the potential digital health interventions? What are our opportunities, our resources? What is the complexity of the proposed intervention? Because we know the more complicated or more complex an intervention is, the more likely it is to fail in the implementation. It's a good example of keeping it simple. Working group then identifies the potential interventions based on the DHPMAT and the documented rationale, all right, after you put it into the context. And then you discuss and prioritize. Having got to that level, that stage, all right, what are the low-hanging fruits? For instance, there's high mobile coverage. So we probably should focus on telehealth or mobile health. What are the examples of midterm intervention might be to invest in the foundations of information sharing? Or you can look at, there's a large young population who are savvy with use of the media, the tools. So you need to think of those kinds of things. So, but this is just some examples. So you use the outputs from the previous steps to develop and prioritize your options. Again, looking at how likely is an intervention that you choose or want to implement is likely to succeed. And then you get real. Okay, so you prioritize it. You say, all right, so what are our achievable and measurable objectives? In what time frame? What is the implementation plan and the roadmap? What is the governance mechanism for implementation? What is the executive or operational mechanisms in place in terms of governance structures? and operational structures, and so on. So the outputs at these different phases would include, so like, so the validation you get to have used the DHPMAT and document it based on current experience and where you want to go, put it into context and discuss and prioritize it in context. So, and the outcome from the decision phase is an implementation plan, hopefully of based on the validation and facilitation phase, a realistic digital health strategy or a project or a program, whatever level you want to pitch it at. So that's kind of the example that we've kind of gone through with the with the Pacific Islands that we had experienced, we had so far. So with that background, I just want to give you how complicated, about how much information there is in the digital health profile. And we'll give you an example afterwards. So there are indicators for country context, for the ICT infrastructure, the essential digital health tools, readiness for information sharing, health system adoption and quality improvement, measurement, monitoring, and evaluation. 17 indicators to describe the country demographics, politics, socioeconomics, and general rule of law. 21 indicators on the overall ICT development and so on, looking at ICT coverage, ICT access, ICT affordability, ICT resilience, and how distributed is the national program. For digital tools, essential, 39 indicators. Look at the current, established, and use. Whole range, all right, from EHRs, unique identifiers, and so on and so forth. So the question to ask is, how has the national health data asset, right, like registers, EMRs, mHealth tools, telemedicine tools, been developed and maintained? So for readiness for information sharing, 27 indicators to assess the readiness in terms of interoperability framework. So the question to ask is, how are health and other information collected and managed to a standard? Health system adoption, looking at the leadership and governance and so on. All right. The questions to ask is, how and where has digital health literacy projects been deployed? How complicated and how complex are the digital health interventions? What are the regulations? What are the structures in place? And then finally, the quality improvement, because you need, you know, once you implement something, you need to see that it's actually doing some good. And you need to monitor, measure and monitor. So are there kind of ad hoc, single site or nationally coordinated quality improvement programs, looking at assessment of large-scale implementations, assessment of financial and economic value, measurements of impacts, including processes and outcomes, all right? Indicators to measure the improved sharing of interoperable and fit for purpose information, data, quality of care, and so on. And looking at the reach, effectiveness, adoption, implementation, and maintenance of the digital health interventions at the individual, community, and organizational levels. And we think these are kind of some of the essential indicators to consider as part of your digital health profile to help you assess your digital health maturity. So this is the tool that we developed, right? It is we're covering the 4 digital health foundations, and we split into 2 slides, all right, information and so on, and the quality improvement. So level 1, all right, avoiding downtime, basic. Level 2, reactive and problem driven. Level 3, standardized, request driven. Level 4, optimized, service driven. Level 5, innovative, value driven. So in terms of ICT infrastructure, all right, some of the descriptors you might have would be unreliable internet, going through unreliable mobile networks, and low percentage of population having access, negligible, expensive broadband service subscriptions, unreliable supply chain, all the way through to kind of, you know, improve reliability, improve access, improve equity of access, and till you get to a stage where it's very reliable and it's kind of accessible, the reach covers most of the population, and most of the facilities, then you can start to optimize it, work out, and start to innovate with it. All right, so these are some of the examples that we give as part of helping people understand how to use it. All the way from, okay, so similarly with the essential digital health tools, we're looking at unique ID, we're looking at information systems, EHRs, social media, telehealth, all right, which can range from telephone consultation right through to asynchronous image sharing to synchronous video consultations enhanced by integration with EHR, and video consultations enhanced by electronic decision support. Okay, so this is the kind of maturity levels we look at, trying to see where you are at and where you aspire to be. Remember, maturity assessment is essentially quality improvement, because if you assess your maturity at any one point in time, you can know where you want to be in the next 12 months or the next 3 years or next 5 years. Similarly, with information sharing, right? No terminology standards, right through to a national terminology, national data sets driving policy and practice, a national common data model driving ethical use of linked health data for innovative policy and practice. Kind of that spectrum or continuum of maturity. Similarly, with the regulations, policy, and strategy as part to promote adoption, all the way to, right, legislations or training programs or governance structures, through to fairly complex and stuff that covers more complex areas like big data and artificial intelligence and so on. The quality improvement might be one of the way to, for the quality or the maturity continuum would be from kind of once-off local ad hoc arrangements for quality improvement monitoring and evaluation, through to, you know, embedded quality improvement programs, through a well-coordinated quality improvement programs across regions or nationally, and right through to using the data in a learning health organization to improve models of care and so on. So that's kind of the rationale behind it, and some of the ways you can use this maturity assessment tool, DHPMAT. So to cover the next phase, you remember we talked about the validation, facilitation, and the decision phase, right? This is some of the kind of, remember we have lots of indicators for it. And what's your mission is, what's your goal for each stage, rather than trying to have an overarching goal, because that's part of the national health priority and strategy. So you need to have practical goals based on the maturity level. So like you can break it down into the essential health foundations, looking at, you know, where you're at and where you want to be. But you don't want to be, I mean, you can't kind of hope to achieve the final goal, you know, in a 12-month sitting. So you need to set to go, say 12 months, 24 months, I get from basic to control, or from basic to standardized in this situation. All right, so like a mobile network, that's a pretty basic ones, all right? So you need to identify options. You need to have funding. So like for instance, you want to do about information sharing. So your current maturity level might be controlled in the sense that, you know, you have data, but they're not really all that fit to be shared in terms of data quality or data interoperability. So you want to at least get to a standardized level. So what do you want to do to get from control to standardized? Identify relevant standards for data models, architecture, software, establish data and information governance and stewardship structures as part of it. And you need to prioritize within this as well, and in terms of funding and other resources. And when you start to prioritize with what's possible and what's affordable. Okay, so this is kind of the way of thinking in terms of getting there in stages. Okay, so that is kind of the toolkit, and the tools. And when you add the digital health profile, is the toolkit, a package of tools that the DHPMAT consists of the digital health profile. You use the digital health profile to assess the maturity, and then you embed quality improvement. So Sameera will give you some examples briefly of what we have done with the Pacific Island countries. Remember, we did it for 13 of the Pacific Island countries. So this is the Exemplar digital health profile. Sameera, you there?
Yes, thanks, Teng.
Yeah, all yours. I'll have a drink.
So, mindful that we're running out of time. So just to take off, and as Teng has thoroughly taken us through how this DHPMAT was created and all the effort that was made. So basically, this is just a very first page of what the 4-page digital health profile for each country looks like. And this information, as you can see, it's quite anonymous because we cannot really reveal each country's information. So this essentially, all the 4 pages, they do cover the 4 digital health essential foundations. And
so you got all the different indicators I've given you in the previous slides.
As
okay.
Teng
So this is
took
how we
us,
applied it.
yes. So they're all covered here, and based on the information from this profile, we then did the maturity assessment for each country, and that's how we asked the stakeholders to do it themselves. So this is for that same exemplar country profile, that this is the digital health maturity assessment tool, which is just again an example. But given the information in that profile, these 4 essential digital health foundations were, to an extent, we would try to do the self-assessment, and the country representatives, they verified that assessment, and it was pretty accurate given the information that existed in the profile at the time. And as you can see, for example, for this particular country, the ICT infrastructure, essential digital health tools, and digital health adoption all could be classified overall as standardized, even though they did not have all the indicators, but because they did, based on the information, as you can see in the last column here. And except for the information sharing, the 3rd essential digital health foundation, which could only be assessed and given a maturity rating of control. And this is the main part of the digital health profile maturity assessment tool. And the second part, the second page, so to speak, or second slide of it, is essentially just the quality improvement of, so the next slide, please.
Yep, you got it.
Yeah, I'm just waiting for it to load here. Thank you.
Yep. So this essentially is applicable, the application of the toolkit I showed you theoretically.
So I think we went around, yeah, thank you.
Okay,
so,
all right, so,
yeah.
So that's the example, all right, of how we apply this, the digital health profile. This is how we applied it into the assessment tool, maturity assessment tool. And this is how they're going to use the information to develop their digital health strategy or program or project, depending on, you know, as I've said, what level they want to target their thinking. Okay, so that's essentially what we've done is we've shown you what we did in the Pacific Island countries and give you some details of how we developed the tool and the toolkit and give you an example of how we actually used it. So summary, and I hope there's enough time to have a bit of discussion. I guess basically, all right, beware of cognitive overload, all right? And I hope this is not. Co-creating is important. Bottom-up engagement is important. A middle-out approach. And that's why we chose the national level is too high level and the kind of operational level is too low. It's somewhere in between. And then you move, you know, kind of pull in people from either the above or below. And maturity assessment is a QI process. And therefore you need measurement, monitoring, and evaluation. So Any questions?
Thank you, Professor Teng and Dr. Sameera. We still have a few minutes left for the Q&A. So the first one is maturity can be measured in terms of process maturity, deliverables maturity, and people or skills maturity. So are you measuring all three?
I think it all depends on the country's priorities. And that's why we adopted this fairly generic approach. That's why, you look at, say, like my country problems, we provide the information of the indicators, so the different types of functional maturity or the kind of domain maturity that you mentioned, the question listed will be indicated by the digital health profile. So you need to put it all together. You need to prioritize, and that's what we're trying to get the tool to help the country or the organization to look at not just one or the other, but to actually look at it in the gestalt and make a decision for your maturity to deal with that particular problem with a reasonable chance of success. So yes, it's all, but it is a generic approach to think about it and to ground it on the evidence that's provided in the digital health profile and make a assessment.
Thank you, Professor Teng. The next question is, do you prescribe a certain team composition for those countries who wish to take up maturity assessments using DHPMAT?
I think that's a very good question. I think it has got to be multi-sectoral. I mean, multidisciplinary, multi-professional. So it's got to, you remember the framework, the WIPRA framework, from family, community, patient, individual, the facility, the health professional, right, whether it's clinical or managerial, and then the system. You need to have the group need to think about these 4 levels. So it'd be good to, without making too big a group, to think about that level. And you also need, from the Essential Health Foundations, some of the technical people. So the actors in this space will need to be interdisciplinary. And obviously, no country is going to start off from a vacuum. They will know roughly what the gaps are without the details, without knowing the details. So yes, it has to be interprofessional. It has to be include the technical as well as the clinical and the managerial. And more importantly, it's got to include the community and the user. I mean, either the community, individual patient or client, or the professional user.
Right. Thank you, Professor. So the next question is, in the countries where this tool was piloted, how many days did it take to undertake the assessment process?
Well, we create the package, you mean? To create the package that comprises the toolkit. Creating the digital health profile took a lot of time. Getting the information and collating them in that space, in that 4 pages. And it depends on the size of the country and the complexity of the country. So that took a lot of time, because depend on the information from the country. So if the country hasn't got the information, you've got limited evidence to work with. Time-wise, I guess it could be, depending on what priority is given, anything from days to months, depending on the delay. But the actual assessment itself, at the most, once you got the data, and depending on the size of the country, it can be anything from 1 day to a few days, or even, thinking along those kind of ballpark figures.
Yes, thank you, Professor. Next question is, were those 13 PICs able to do the assessment via the DHPMAT all by themselves, or they needed external support, for example, consultants?
I think that's where the WHO country offices are very, very useful. And some of the Finn people, I think, but the WHO Pacific Island support, especially in the acknowledgement, Katri Contia was very helpful, and some of the people who came to the Finn workshop were very helpful in terms of developing it.
Yes, all right. Thank you, Professor Teng and Dr. Sameera. We have reached the top of the hour.
Thank you very much, everyone.
Yes,
no, except if you want to, I'm sure, if you think of anything that we can do to improve this tool, please contact me on the email.
Yes, thank you, Professor Teng. Sir Jai?
Thank you, Professor Teng and Sameera, for this webinar. It was very interesting, and then especially when we are actually flooded with so many of the digital health indicators, assessment frameworks, and tools. It's good to know, and then and also like it is good to see if you presented, which tool actually does what, and then where it compares. There are a couple of other questions that may be there. In fact, one of our eHealth members and partners is right now on the call, who was involved in the HIS stages for continuous improvement. In fact, he has some questions. Probably I will connect you after this webinar, and then you can take the discussions ahead. And thank you very much once again, Professor Teng and Sameera. Thank you.
Yeah, thanks, Jai. We'll look forward to any suggestions you have by email and any people that we should speak to.
Sure. Thank you.
Thank you.
Thank you, everyone. Bye.
Bye.
See you next Monday.